my best chance of saving somebody is reminding them that they can kill themselves, and then offering to them the alternative of the prospect of doing it differently. And I like working a lot with veterans, and we've got a clinical trial starting up at a VA hospital. And one of the things I love about working with veterans is they came in from a world where they were not always in combat, but they were trained in a fighting force. And so historically in their development at some point, they were trained to fight or to be fighters and to have the warrior mentality. Well, I think good psychotherapists working with suicidal people can invoke the warrior mentality to fight for your life before you give up on it. And I think if it's skillfully presented, not provocatively, not in a flip kind of way, but in a very genuine way from the heart, it is experienced as empowering, empathic, non-coercive, inviting, and tenable. And then really, if you can get somebody on board at that level, and then show up and deliver, and they show up and deliver, I've just been amazed at really scary people that we've been involved with or I've seen personally in treatment who can come out of the woods relatively rapidly. And then some people, they need a much more intensive, longer-term reboot. They've got to really, really work it out over time. But even those folks become less symptomatic. They may cling to suicide as something that they've believed in like all their life, throughout childhood, through their teenage years, into their young adult years. And so to rip that away from them, I think is disrespectful. But we don't have to be blackmailed by it. And I think that that's what I'm sort of arguing, is that clinicians can kind of say, these are my limits. And this is the way I think treatment should proceed for you. And I'm pretty hardcore about, if you've got a gun at home, you've got to get the gun out of the house for the month or 3 months that we're working together. And if you're not comfortable with that, that's okay, but then I'm not your guy. And I'll have to make a referral to somebody else. Because to me, I'm a student of the surveillance data, that it's very clear that gun's more likely to be used on yourself or someone that you would love, especially if you're suicidal. And it really undermines your suicide life-saving treatment. So I'm not sure I'm interested in pursuing a line of work with you. And I actually don't think it's unreasonable for 1 month for you to secure your environment to see if we can find a way to save your life.